We were well supported from the time we were told my wife's cancer had spread and was terminal to when she died. Her GP called her in the week after the consultant told us it was terminal and spoke with her on the phone and reassured her she could call them whenever we needed them and ask any questions we had.
We were well supported by the nursing staff. We have a big family and they allowed us all as much time as we needed to come and see him. They arranged for a priest to come and pray with us, which was really important to my mum and gave her a lot of comfort.
I was crying in the coffee shop and a mental health nurse came and sat with me and listened to me and checked I knew where to go and what to do, and when I was ready took me back to the ward where Dad had died. It was nothing to do with my dad's care, but just saw I needed someone to be with me and did it without being asked. Just a chance encounter, but everyone at the hospital was like this. I never got to say thank you to him.
Unable to express how the fact that a 44-year-old man who was given a good prognosis could have been so let down. Nobody checking his progress. Can't believe in 2022 this could have happened.
It felt like there was something lacking in terms of empathy. I remember asking one of the nurses if he could hear us talking to him, and we were told probably not, with a shrug, and she walked out the room. I felt like he was a lost cause and so didn't require anything more than bed and a basic level of care until he was no longer there.
I remember they took us to the family room after she had died. We sat for a bit with one of the nurses. She was very comforting and gave my son some information to take away with us. On reflection, I feel there should be follow-up support, not just at the time of death, given the different stages of grief.
The staff cared for my dad reasonably well, but they constantly felt rushed and not the most welcoming to us as visitors. My mum has dementia, so she would often ask questions. It felt like we were a burden to the staff being there and asking for information.
One member of staff at the nursing home went above and beyond to spend time with my relative in her final days, talking to her and holding her hand. Staff took care to ensure my relative was not left alone, even sitting with her during their breaks.
I felt lonely and didn't know where to go for support. I didn't want to bother my GP with it.
The children have been very let down by the lack of support. They were given a memory box at the hospital, but then there's been nothing. GP said there's at least a 9-month waiting list